Hi, I'm Dr. Samantha. I'm a board-certified nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm perinatal mental health certified and maternal newborn nursing certified. Stripping of membranes is a common procedure to help induce labor. Today we'll be talking about everything you should expect if your provider strips your membranes. So click those like and subscribe buttons and stay with us. So stripping of the membranes is a procedure. This involves inserting a gloved hand into the vagina to sweep the membranes between the amniotic sac and the uterine wall. When this happens, your uterus will then release some hormones that can help to induce labor. This procedure can only be done if your cervix is partially dilated. So if you are at 0 centimeters, your provider will be unable to do this. You may be asking yourself, why would my provider even want to strip my membranes? The reason to do this procedure is that it may start your labor. When the amniotic sac is separated from the uterine wall, it releases prostaglandins. Prostaglandins are hormones that help to ripen your cervix, which thins it out to allow the baby to come down. It also can help to start contractions. So stripping the membranes is considered a natural induction method. I think this is one of the most important things that you should know if you're going to have your membranes stripped. Having your membranes stripped is painful, okay? It can catch you off guard. I think a lot of providers try to advertise this as a natural procedure that's no big deal. But from talking to women, it can be pretty rough. The pain may feel sharp. It also may feel burning, or it may feel like pressure. Most of the time it's a lot of pressure, okay? But the thing is, you need to understand this is like having a very rough cervical exam. It's not like any other procedure you may have had before. Many women come out of stripping their membranes feeling like they've been manhandled, and they can actually have a lot of emotional damage from it. Make sure you have a partner with you, somebody to support you, and understand that it is considered a normal procedure, but you may not enjoy what's going on. And I think that's very important, so you go into it knowing what to expect. Please remember to hit the like button and subscribe so you can get our latest content. After your procedure, there are a few things you should know that might happen. First, you might have some light bleeding. This is because stripping the membranes is a slightly invasive procedure. Next, you may experience some mild contractions or cramping. This can actually be a good thing. This may be a sign that the procedure worked. If you experience any severe pain or major bleeding, you need to call your provider right away or head to the nearest emergency room. These are not things that should happen normally. And finally, you need to know that stripping the membranes doesn't always work, and it doesn't always work right away. Sometimes this procedure may take place and labor will start a few days later. Before you have this procedure, your provider should review the risks involved with stripping your membranes. Some of these risks include an irregular fetal heart rate, too much pressure on your baby's umbilical cord, a tear in your uterus, and this can lead to an increased risk of you having a C-section or, unfortunately, fetal death. All right, so the last thing you need to know is that there are some contraindications to having your membranes stripped, because a lot of women want to request this procedure to try to induce labor. If you have a history of having C-sections or preterm births, you're not eligible for having your membranes stripped. If you're currently having placental issues, during your pregnancy or a bacterial infection or an active herpes infection, you also cannot have this procedure done. A previous uterine rupture, fetal issues, poor fetal position, or pelvic abnormalities also rule this procedure out. I hope this video has helped you learn about membrane stripping and what it involves. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe buttons so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.